International Nurses Day is being observed today. This year's theme, Nurses, a voice to lead, a vision for future healthcare. Now, this is the second year that the healthcare workers will commemorate the day under COVID-19. Nursing Union, DENOSA, is hosting the celebrations in Pretoria, and that's where we find Zikhona, Tshona, our reporter there. Zikhona, a very good morning to you. And to say it's been a difficult period for nurses, not just in our country, but worldwide, would be an understatement.
Certainly, Koli, and we've heard time and time again where healthcare workers have been speaking, urging the public, South Africans in particular, that they should comply with the COVID-19 regulations, not only to keep themselves alive, but also to guard their lives. They are the ones at the forefront of helping our country fight the spread of COVID-19. As you've mentioned, the official events are taking place at the CSIR in a convention center here in Pretoria, hosted by DENOSA. We know that the Minister of Health, Dr. Mzweli, will be addressing at this event. He's expected to take to the podium at around 10 to 11. The President of DENOSA will also be speaking, Mr. Simon Hlungwane, also will be addressing. I see here that the program is quite lengthy and has topics such as the impact of this pandemic in particular on nursing. How has that changed the way nurses do things? But to talk to me more about the significance of this year's celebrations in particular, I'm joined by the Acting Secretary General of DENOSA, Kasim Lekhwati, just to give us a sense of where we are in terms of addressing the challenges facing nurses, particularly during this pandemic.
No, thank you for hosting us during this trying time. Today, International Nurses Day is commemorated, celebrated in a very unusual way. Normally, it will be a very celebratory moment, but today we take a stock and we refocus on the sacrifices and our colleagues who have passed on whilst with their boots on duty. And we want to say also, this could have been avoided at all cost if only we have come to the table on time as the government to prevent by giving us the appropriate PPEs, which we've always been crying for. And furthermore, that to add injury to the whole thing is that even with this rollout of the vaccines, we have not done any significant progress in that regard. And we are very worried as we are getting to the third stage phase of the COVID, of the infection rate. There's still not, the rollout has not yet been effectively rolled out. And that is compromising our healthcare workers, in particular the frontliners, to actually do their work. There is a report that has been released today by the International Council of Nurses, the ICN, that pleads and talks to governments of this country, including South Africa, that tremendous efforts will have to be made in terms of addressing this, what they will call is the gradual disruption of COVID-19 that is causing countries' healthcare systems to collapse. And we have also noted in the report, the survey from January that was released today, it says that they have found out that just over 40% of the 105 countries where the survey was done, including South Africa, that their country's chief nursing officers are not taking any significant role in terms of involving nurses in terms of eradicating and controlling this.
Great. So before I let you go, just briefly, I'm sure we'll hear more about this report in the program today, but for the sake of time, before I let you go, the Minister, who is the head of the health department here in South Africa, will be addressing today. What are you hoping he will touch on? I know you've mentioned the vaccine issue and as well as PPE. What are you hoping to hear from the Minister?
I'm hoping that the Minister will come up with a plan as to how effective can we go on to with the rollout of the vaccine so that we can cover the very same caregivers who are there to protect the populace of the country. So that will go a very long way, and it will also demonstrate confidence among the nurses that at least they are protected in order for them to do their work. Because nurses, by their profession, have taken a pledge that they will serve their communities, irrespective of the challenges we're having. But we expect for the minister to come to the party and say, these are the measures that are going to be taken place. The issue of addressing the shortage of staff, and also involving nurses as scientists in terms of dealing with the issue of the infection. A lot of infection control nurses are not being given a chance to display their ability.
Thank you so much. That's the acting Secretary General of DENOSA, Kasim Lekhwati, who's saying that they hope to hear from the minister how he will and his department will address the issues facing healthcare workers across the country, the issue of shortage of staff and the issue of vaccination. We know that phase 2 of the vaccination program is expected to get underway from Monday. So hopefully the minister will shed more light as to how that program will be rolled out for healthcare workers across the country.
Zikhona, Tshona, thank you very much for that update. She is at the event that will commemorate International Nurses Day here in South Africa.